Hey, it's Dr. Tasha. A few months ago, I did a talk with Cohort Sisters, an organization that I really support and agree with. You can find out more about them below. But I did a talk with them about how to prioritize your mental health as a graduate student. I have been a graduate student as a business school student and a medical school student. And then as a psychiatry resident, I think I have a few tips and tricks that I can share personally and professionally in case you're having some challenges in your grad school journey, some tips that might help you to be able to, have a little bit of an easier time or find some toolkits to cope along the way. Leave some comments down below to let me know your thoughts and stay tuned for this recording of the video. So kind of with that, a little bit of an overview about my own graduate school process as a medical student and then as a business school student, recognizing, that it is different than the PhD journey, but there are a lot of parallels. I want to share some practical tips of what are things that you can do to prioritize your mental health as a graduate student. Going back to what I said before, the thing I'm going to say over and over and over again, and I say it a bunch of times because I want this to be something you take away from this talk, but the idea that our thoughts, our feelings, and our behaviors really do make up a large component of our mental well-being. So you have to be able to understand how these things interact in order to recognize how can we contribute to, or how do the things we do maybe impact these elements. So kind of going back to this, I want to think about just to recognize, right, that feelings, thoughts, behaviors, they interact. So for instance, if today, I love the question of how you're feeling in terms of a color. I'm feeling orange today. To me, that means that I'm feeling well rested. I feel ready. I feel eager. I'm in a space of being able to pour out, which is, I'm glad I'm feeling that way because, I'm able to pour out into you all. And what that does is it impacts my thoughts. I'm in a more positive mind space and I'm able to, communicate in a way that I hope is resonating with the folks who are listening. And hopefully that feeling orange will continue on into the rest of my day, that I'll be able to work on my patient notes effectively, do all the things I need to do here in my clinic. But let's say, I don't know, this morning when I woke up, I wasn't feeling all that orange. I was feeling maybe a little bit more gray when I woke up because I was still a little tired. And then that makes it harder for me to get out of bed. I ended up missing an 8 o'clock seminar that I really wanted to watch because I wasn't feeling super great. And my thoughts there, I could easily have jumped to judgment of, wow, like I wanted to learn about this one drug that's being, rolled out in Philadelphia and I missed it. And I could be really self-deprecating about that. Or I could say, you know what, I missed this talk, but I can go read about it instead at another point. And I share that to say that even just in this one day, my feelings have shifted and will continue to shift probably as the day goes on. And for you all to recognize that it's okay for feelings to shift. It's okay for thoughts to shift. It's also okay for behaviors to change, but we have to recognize how these things link and how we can be playing a proactive role in being able to interject when we feel like there's a kink in the way that these feelings and our thoughts and our behaviors intersect. So kind of thinking a little bit about external roadblocks, because we can say all we want, and I will talk about this, of things that you can do to promote your wellness, but oftentimes we meet roadblocks that inhibit either our emotions, our thoughts, or our behaviors. And specifically to the context of graduate school, you're thinking about, and for women of color in particular, of decreased access to mentors, poor mentorship if you do find it, an equitable distribution of resources or knowledge about grants that might exist, or different funds that, or even just catalogs or libraries for different resources and how that information might not be shared equitably. Financial stressors. So, some people may have external funding that's not the grant money that goes towards school that may be able to help, whether that's extra jobs, parents who are able to help, with financial costs. But if you are experiencing financial stressors, that contributes to a roadblock to mental wellness. People are in varying stages of life. You may be in relationships, maybe struggling with romantic relationships that may be, trying to figure out the course of them, whether you have children or not, whether you have to care for elderly family members or ailing family members, and even going back to the finances, recognizing that Black and Brown communities are more likely to have to pay back financially to other family members. So whatever those stresses are, familial obligations, those too can be external roadblocks to mental wellness. Bullying. So bullying is something that is quite common. And I did a little bit of reading specifically about, graduate school kind of coming into this, about when you're thinking about the interactions between peers in a graduate school program, or even from supervisors, that not only is there maybe poor mentorship, but active bullying and putting down of the work that people are doing. And when you're dealing with these external roadblocks, it can be incredibly challenging to maintain your mental wellness. And then unrealistic teaching requirements, where you're expected to dually be a researcher, a presenter, someone who's also then pouring into and teaching others, whether that's graduate students or whomever, or undergraduates or whomever. But all of those external, and you could probably think of your own list to add to this, of the external roadblocks to your mental wellness that you're experiencing. And then we also want to think about internal roadblocks as well. So going back to that idea I had mentioned of kinks in the processing, where's there a kink? Like, are your feelings the thing that gets in the way? If you start feeling a more negative emotion, is it challenging for you to get out of that? Does it then lead to a spiral where your thoughts are negative, your behaviors are negative as well? Maybe you're someone where it's difficult to get going, where you know the list of things that you have to do, but procrastination is your best friend and you're not able to get things going in an appropriate manner. And sometimes we have to check in with ourselves that the internal roadblocks can be just as dilatory and detrimental as the external roadblocks. But sometimes I like to focus in on the internal roadblocks because that's where we have agency. Unfortunately, unless you are someone who is actively working when it comes to those external pressures and those external things that impact our well-being, it can be challenging. It's hard to be focused in on a study that, if you're someone who is in the hard sciences, to be in your bench research, but then also be trying to fight systemic racism. It's hard to do both. Not to say that it's impossible, but it's hard. And sometimes focusing on the things you can change can be where you see a lot of the benefit for mental wellness. So going into this even more, so from the thoughts perspective, are you having challenges? And these are just some examples that I kind of threw up here. It can be anything, but imposter syndrome, incredibly common within Black and Brown communities, especially then with women, where you're thinking about this idea that maybe I don't belong in this space. I'm the only one here. Do I belong? Am I as good as the others? So those thoughts, even though they're more likely than not to be inaccurate, can be the thoughts that are swirling around in your mind. Are you doubting God or the plan that you may think that God may have had for you? Are you doubting yourself and your abilities, even though there's evidence on the contrary, where your resume up until this point, all of the things that you have done have shown that you deserve to be in the space that you are in, have shown that you have the skill sets to be able to be accomplished in your field, but you have those thoughts that are negative. Maybe your roadblock is how you feel. Maybe you're someone who leans towards having more anxious thoughts. Maybe you have more of a depressive personality. Maybe anger, fear, insecurities. These are things that you struggle with on the day-to-day. And one thing I want to pause and highlight here is that, we often think about anxiety and depression and these more, quote, negative emotions as things that you want to avoid. And I would say no, these are things that we want to be able to experience in ways that are healthy. Anxiety is a human cue that, alerts us as to when things may be dangerous. We want to have anxiety at times to be able to help us navigate spaces. But if it's maybe becoming a little bit cumbersome and not allowing you to be able to actually get things done that you need to be able to do, that's when we think of it as a negative. But anxiety in and of itself isn't a bad thing. It's more, what does it then lead to? Is it impacting the thoughts you have about yourself? Is it self-limiting behavior of my anxiety is inhibiting me from volunteering to do a talk that's available? Or is it inhibiting your desire to sign up for opportunities that are coming up? That's where we kind of think about it becoming problematic. But this is where some of the things that happen. And if you allow these things to kind of control how you're feeling, that's where we're leading into the issues of our thoughts and our behaviors as a result of these feelings can then lead us towards the idea of mental illness as opposed to mental wellness. Behaviors. So again, just kind of going through some examples. So procrastination, I mentioned that you're all familiar with procrastination at some point, I can imagine. Minimizing our personal agency. So again, thinking about what are the things that we can do really overvaluing the things that we have capability to do so that we can maybe decrease the value of the external issues that we are unfortunately unable to change. Self-care is another big one of, are you eating? Are you exercising? Are you sleeping? Sometimes you can think of it as the basics, but those behaviors genuinely do lead to wellness. When I think of things from my perspective in psychiatry, a lot of the times folks with mental illness, some of the most basic ways to impact that is just simply, are you sleeping? How much sleep are you getting at night? For myself personally, I know my anxiety flares insanely if I do not sleep. So just making sure that I am getting a lot. I sleep a lot. I sleep like 9 hours. I have to be able to do that if I'm going to be like highly functioning. But if I start chipping away at that so that I can be more productive, that just kind of creates this idea that the behavior there then impacts my feelings, it impacts my thoughts. So wanting you guys to think about, where on the spectrum do you see yourselves as having the biggest strength and maybe the biggest weakness of, is it your behaviors where you kind of have the biggest challenge, or is it the thoughts that come to mind of where your challenges lay? Things that are just important for you to recognize about yourself as you're thinking about your mental wellness. So one thing I want to make sure that we are discussing, and I'll go through this maybe a little quicker than I usually would, but I do think it's important to think about potential red flags for possible mental illness. Because again, as I had said earlier on, it's a lot easier for us these days to talk about mental health, which I think is great. But I also want you all to start to think as well about mental illness and the fact that, again, I said 20% of people are experiencing it at any given time, and that's across the spectrum of all mental illnesses. So it's likely that whether it's you, whether it's a loved one, a peer in your program, just to be able to give you some tips of what things you might want to look for. The biggest thing I say is a change. When we're thinking of mental illness, we're looking at this idea of mental health and mental illness on a spectrum. I talked about emotions, behaviors, and thoughts. Mental health is when those things are allowing you to function in an adaptive manner. Mental illness, it's when either those thoughts, the emotions, or the behaviors are now kind of leading towards maladaptive experience. So the breakdown here, we think about cognition. So thinking about our thought process, our memory, our concentration. If there are changes, that's where we start to consider possible. And again, I say this as possible because I can't teach you to diagnose in like 2-3 minutes, but possible experience of mental illness. Mood. So if maybe someone's a lot more reactive when it comes to emotions, that's something to consider. Someone's becoming easily irritable or really sad at the drop of a dime or really angry at the drop of a dime. These are things for us to consider as we're interacting with the people who are in the spaces around us. Speech is another one, and I think probably something that can be very easy to recognize from the lay perspective, where even pace is something that's to be considered. So I try my hardest when I give presentations to not speak too quickly. It generally tends to be a challenge, but if all of a sudden you were to see me 5 years from now and I'm speaking incredibly slowly and it's really hard for me to get words out, that could be concerning. That could be oftentimes when people are experiencing depression, things are slow because it's much harder for them to do. So people might be speaking really slow, might be moving really slow. I had a patient right here in my office 2 weeks ago where I just noticed such a stark change in when I had met her a few months ago compared to now. Everything was slow, like she was moving in slow motion. So that's the example of something that could be easily recognized of possible mental illness. On the exact opposite end of that, if someone is all of a sudden talking like a mile a minute, you can't get a word in, and it's so incredibly impossible to stop them from talking, that could be mania. Or it could also be substance use, which we do account in, when we're thinking about mental illness. So things to think about when you're looking towards yourself or to others in your communities. Thought patterns are where people are thinking a little bit out of what is based in reality. And you find it very difficult to follow what they're saying. They're linking ideas that don't necessarily make sense. Changes in thought patterns like that can be related to mental illness. Another really apparent one is hygiene. And this might be one, and people kind of joke about it when you're in semester or final exam season, when all of a sudden it's sweatpants or a bust and you're not caring for yourself as much. You don't have time to put on the makeup, don't have time to do those things. But when it's really to an extreme, right, where people may be going days without showers, not doing their hair at all, maybe wearing the same clothes for days on end, or you're noticing their clothes may not be washed, those are examples of things that you can keep an eye out for when you're thinking about possible mental illness. Again, it's looking at the idea of the emotions, behaviors, and thoughts that exist when you are mentally well. But when you start to have changes that are leading to distress or to difficulty with function, that's where we're thinking about those changes that could be related to mental illness. So I want to pause here because I've been talking for a bit and kind of went over quite a few things, but I want to pause and I want to give you all a moment to personally reflect on some of the things I just talked about. And I will give you about 2 to 3 minutes to kind of just do this on your own, whether it's, just reflect in your mind's eye, you reflect if you are someone who uses notes on your phone, a piece of paper in a journal. But some questions I would encourage you to think about right now are, how would you describe your current state of mental health? Another question to think about, what has your mental health journey been like so far in relation to your graduate training? What mental health goals do you have for the next month, for the next semester? And what area of mental health is your greatest challenge? Which is your greatest strength? Because I know oftentimes with these presentations, folks will, kind of hop off the presentation, just go on to their next thing. So I want to build it in for a moment of reflection for you to think about this for yourself.
Hey, popping in just for a quick commercial break to remind you to subscribe to my channel and like and comment down below if you're liking the content so far. Hope you enjoy the rest of what's to come because there's a lot of good information in store.
So as you're wrapping up your reflections here, I would encourage you, if you're someone who journals, to continue to think about these going forward. If you feel comfortable, feel free to drop comments about some of the things you reflected on in the chat. I think it would be helpful, for others to see. Maybe there's someone who's dealing with something similar to yourself, or to get a sense of what maybe goals others have or things that you could try to adopt for yourself. And as we get towards the end, I would hope for us to have a chance to have discussion as well. But I really wanted to just bring in this moment for you to be able to reflect on some of what I've talked about so far. So kind of going to what can we do? So we've talked about what makes up mental health, what could potentially lead to mental illness in the sense of the changes that one may experience, but what can we do? So I'm going to talk through, a bunch of different categories of ways that we can lean on different things that will impact our mental well-being. So we know that, over 80% of Black people recognize that faith or spirituality of some sort is of great importance. So I wanted to make sure that I added this in here, that using your faith is an incredibly important part of maintaining mental wellness if this is something that is of importance for you. So whether that's leaning on your church community, or your, in your synagogue, or, in your mosque, or wherever it is your place of worship and your sense of spiritual community, think about that as a space of building support. Discussing challenges with trusted religious leaders, spending time in prayer or religious meditation, worshiping. And this is, I took this slide from one of my talks to a church, so it is Christianity centric, but thinking of this applicable to all faiths, where whatever it is your religious text is, the Torah, the Quran, whichever, leading into things that grow your spiritual health is incredibly important to your mental health if your faith is something that is important for you. Something else that we can think about are, overcoming the roadblocks from a behavioral perspective. So sometimes I like to say, sometimes we just need to get it done when there is the procrastination that can impact us. What are ways that we can, go over those roadblocks, or maybe, go under or around, whichever way allows us to get past the roadblock to our mental well-being? Let's think about it. So in the reflection questions, I asked you to think about goals for the next month, the semester, or the year. Making a plan. We know that you are 42% more likely to actually achieve a goal if you write it down. So something as simple as writing your goals down can be helpful to help you to, think about the ways that you can improve your mental well-being. So if your plan is related to exercise, writing it down can be helpful. Putting it in a space that is visible regularly. Something I've started doing recently is on the door I have to exit of my home, I have sticky notes of things, of reminders to myself, so I can check them off as I am able to achieve those things. Finding an accountability partner. So whether that's a part here of the mentorship you find in cohort sisters, or if it's at your program, or in whichever spaces at your job, the spaces that you're inhabiting right now, finding someone who can check in on you the same way you can check in on them about the goals that you have set for yourself. And one thing that I have found incredibly helpful when it comes to reminding myself how to show up every day to my fullest potential for the work that I do is to focus in on the purpose. Why are you doing what it is that you do? Whether it is in grad school, in your home, in your community, focus on the why. That's one of the ways that we can help ourselves from a behavioral standpoint to get going. We use this fancy term, quote, behavioral activation. If you need to be able to be reminded every single day of why you're doing what you're doing, put it somewhere where it's visible. Maybe it's on the lock screen on your phone, on the backdrop on your laptop or your desktop, so that you can focus in on the why of what you're doing and not so much the praise. Because a lot of times, and I think too with society where the social media popularity, and whether it's getting featured, you're featured in this, featured in that paper on the news, and people are seeking those awards and those lauds, but not focusing so much on why they're doing the things that they're doing. And that can be a way in and of itself to help from a behavioral standpoint with mental well-being. Some other things. So integrative therapies, unfortunately in psychiatry, don't get talked about enough. And I've mentioned some of these, but I want to go through them. And I think possibly part of the reason why they don't get talked about a lot is because of the fact that, there isn't as much literature as there are for drugs, because there isn't as much money as there is for medication. But nonetheless, we do know that varying herbal remedies can be helpful. Acupuncture can be helpful with stress relief, with anxiety, with many different things that folks experience from a mental health perspective. Exercise, I've already talked about how that can be helpful. We talk about endorphins and the positive neuromolecules that are increased when we exercise that help to promote that mental well-being. Meditation, whether you use meditation as your practice of mindfulness, massages, they can be great. Massages can be nice just because you have an opportunity to have the tension in your body released. It's a moment to just mentally be in the space of that room. They often have like great music playing that's just really relaxing. That in and of itself can be a way to overcome the roadblocks that exist to mental well-being. Guided relaxation. So I saw in the chat that someone said they felt like they were body scanning when they were doing the mindfulness. And that was an example actually of guided relaxation of what I was doing, where body scan can be incredibly helpful to just be able to bring yourselves in connection with your body in the present moment. Yoga is another one that allows us to be able to focus in on our physical well-being, which then contributes to our mental well-being as well. Some more specifics, because again, I said I wanted to be able to provide you all with specifics of things that can be done. And often when it comes to that self-agency perspective, the behaviors are where we find the most ability to impact things on our own. Thoughts and feelings, you can impact that as well, but sometimes it's honestly just a bit more challenging to teach that didactically, and that's where therapy tends to come in, whether you're doing cognitive behavioral therapy, dialectical behavioral therapy, all of these different types of therapies. But it's easier to teach those in the context of a therapy setting, whereas in the presentation, it's a lot easier to just talk about the behaviors that you can do. So on an average, people need anywhere from 6 to 9 hours of sleep. And for you, it's important to know what that is for you and set up a plan. Again, going back to what I said before, a plan to actually achieve those. Exercising. So exercising 30 minutes a day is great for your physical health, your mental health, helps to slow down rates of cognitive impairment going forward. So really just helpful. And even if that's just taking a walk, building and walking to campus rather than hopping in the Uber or things like that. A healthy diet. So some of the things we've seen, reducing fats, reducing processed carbs, actually even reducing calories to within the need for your body rather than being in caloric excess. Those are things that help to minimize rates of depression, also help to minimize rates of cognitive impairment as well. Positive supports, staying involved with cohorts, this does, finding other groups that are helpful, whether it's a spiritual group, it's groups of people who have shared interests, a running group, a group of folks who like to knit, whatever it is that you like, finding positive social supports in that. Regular journaling. I saw someone, folks threw in the chat that they like journaling. And that it's great. I regular journaling, I use that with like a little asterisk that whatever is regular for you. There's times when I journal every day in a week, and then there's times when 3 weeks have gone by and I haven't journaled, but then I pick the journal up again, and it's something that helps me to just get the thoughts and feelings out of my body and into a place where I can read it with more objectivity. Something else to consider, avoiding alcohol and other drugs as a coping mechanism for stress. So, thinking of some of these other things like journaling, exercise, healthy diets as positive coping mechanisms for stress, when we find ourselves, kind of going to alcohol every day after it's like a difficult day, or using things like marijuana to escape the feelings of stress that we're having, that's where we lean towards, coping mechanisms that aren't as healthy, and avoiding that as a means of kind of erasing the thoughts and feelings and emotions that we have. That's where we talk about avoiding alcohol and other substances in those settings. And then I would be remiss not to, mention seeking a professional when necessary. And sometimes it's not always known when you need to seek a professional, but if you feel like things are really just overwhelming, it can be helpful to just even have an intake. An intake meaning that you go have someone do an assessment, and they can let you know if therapy is helpful, or if there are other things that they might be able to recommend that could be of help for you. Or if even medication like an antidepressant or an anxiolytic would be something that could be helpful for you. Therapy. So I've mentioned some of these. I wanted to just share, there are like probably hundreds, honestly, of different therapies that exist. But they're just so that you have ideas of the names. There's supportive psychotherapy, cognitive behavioral therapy, as I mentioned before, psychodynamic therapy, which is to explore the past experiences and how they're impacting you in the present. Different types of things types of therapy that can be helpful specifically to address the thoughts and the feelings, as I had mentioned before. Therapy can help with behaviors as well, but as I said, we often can have a little bit more agency with the behaviors on our own. Meds. This is not for you to know every single kind of medication that exists, but there are antidepressants if you're feeling depressed or anxious, antipsychotics for people who experience psychosis or bipolar disorder, mood stabilizers for bipolar disorder, anxiolytics for if you're experiencing anxiety, stimulants if you're experiencing ADHD. So again, I'm a psychiatrist, so the medication is kind of my bread and butter, but I do the therapy, I do the other behavioral activation things as well, because it's all a part of understanding that connection of feelings, thoughts, and behaviors. So to kind of just wrap up, I wanted to just emphasize the fact that mental health and mental illness they're on that same continuum of the cognitive, emotional, and behavioral well-being. Our behavioral changes can often, offer achievable means of maintaining mental health. So today, wanting to specify this idea that as a graduate student, you can prioritize your mental health, and walking through some of the ways that you could do that on your own before seeking a professional if you need that. And again, as needed, if you need to seek a professional, there's nothing wrong with that. I have both. I have a psychiatrist and I have a therapist for my own well-being. And it's something that I encourage folks to get that help if it's something that you need.
Hey, it's so good to see that you've made it to the end of this video. Thank you so much for watching. If you've enjoyed it, please share with someone. And I think that you're gonna like this video right here because it's gonna help you to learn more about the topic you just watched. Have a good one.